Hi, everyone. We are going to be talking about professional conduct or sexual misconduct in the massage therapy office. This is a combined PowerPoint. I have some stuff from Gary Adkins, who was a previous instructor at this facility, and his poll from ABMP, and also some from our fundamentals book for this class that I have pulled into this as well. Right. So, what is sexual misconduct and what does that include? So, we have a term called sexual impropriety, and this comprises of sexual behaviors, gestures, or expressions that are seductive, sexually suggestive, or sexually demeaning to a client. A sexual transgression is about an approach or behavior that is sexual in nature and goes beyond the limits of the victim. This does not have to be a physical event. Sexual violation is an all-encompassing term. It's not a legal term, but it is one that we refer to crimes like sexual assault, rape, sexual abuse. With sexual violence, the aggressor uses force, physical or otherwise, to commit a sexual act with the victim without their consent. All right, Gary has in here, according to the ABMP, sexual abuse in a therapeutic relationship, the practitioner develops a power advantage, which we will be talking about, called a power differential, and that is considered a legal caregiver of the client. For this reason, any sexual misconduct, regardless of whether or not the client consents, is considered sexual abuse. The practitioner is responsible and liable for sexual abuse, even if the client initiates the sexual behavior. Sexual abuse is punishable by the law and may lead to severe fines or imprisonment. Sexual harassment is uninvited or unwelcome verbal or physical behavior of a sexual nature, especially by a person in an authority position, right? A practitioner with a client, because of that power differential that exists in a therapeutic relationship. Sexual harassment is punishable by the law and may also lead to severe fines or imprisonment. We mentioned sexual impropriety a moment ago, but this is a failure to observe professional standards or show due modesty in the massage environment. Examples of sexual impropriety include poor draping practices, telling sexual jokes, discussion of your own sexuality within earshot of a client. Maybe you're joking with a coworker about your sexy boyfriend and whether or not you're female, it may state what you prefer in terms of your sexuality. This is inappropriate to talk about in the office. Gender-based comments or sexual stereotyping based on sexual orientation, requesting a date or acceptance of a date from a client, emailing or calling clients for reasons unrelated to the massage session. Okay, this can even mean if they were talking about their boyfriend, because a lot of times clients do get that verbal diarrhea when they get comfortable on the table, and they will spill things about themselves. They will breach those personal boundaries. Well, if you reach out to them to follow up, even if they want you to, this can also be sexual impropriety. This can lead to sexual harassment charges. Sexual innuendo is an insinuation, an oblique remark, a hint, an overtone, undertone, or an elusive reference that suggests sexual interest or intent. So, hanging artistic nude photographs in the massage clinic. There's a question in your boundaries and some of your ethical things about, hey, what's something that's appropriate for one profession but not appropriate for a massage office? Well, this is a perfect example. You can hang artistic nude photographs and paintings in an art gallery all day long, and people will, pay good money to come in and see it. If you hang it in a massage office, this could be considered sexual innuendo or sexual harassment. Calling a client by a sexual nickname such as honey. Now, if you're from the South in the United States, everybody calls you honey pie, sweetie bun, all of these various things. You cannot do that in other areas of the United States. You technically can't do this to your clients in the South either, because they may not come from the same culture as you, and it will be taken as a sexual innuendo and not as a casual remark in the local area. All right. Making approving body comments like, you look great in those jeans. Now, your client may have been working on weight loss or working out, and you think that you're giving them just a perfectly nice, reasonable compliment. However, it can be misconstrued as sexual innuendo, especially because of the intimate settings of massage therapy. Clients can misconstrue these things quite easily. So anything that could be misunderstood as a sexual innuendo, don't say it. All right, now I'm going to be pulling some things from Mosby's Fundamentals. This is your class textbook. It is hyperlinked to the homepage, so you can access chapter 2 there, which is what I'm going to be referencing for these. All right, massage therapy and intimacy. Intimacy is the state or fact of being intimate. What is intimate? That is the inmost, essential, internal, most private or personal, closely acquainted or associated, familiar. Now, this is from the Webster Dictionary. This is the sharing of privacy, okay? Sensory, connected with the reception and transmission of sense impressions through the nervous system. All right, we talk about the corpuscles and things when we discuss the nervous system, how we sense light touch, nerve strokes having a reflexive response. We're going to be covering a lot about the reflexive response in the parasympathetic nervous system and inadvertent sexual response today. Stimulation is the act of exciting or increasing activity. When we talk about stimulation in the endocrine system, we're talking about hormone creation, right? We're turning those glands on, we're stimulating them to produce their hormones. In this case, we're going to be talking about the exciting or increasing sexual activity of a client. All right, the work of a massage practitioner is sensory stimulation. Therefore, by its very definition, body stimulation is sensual and may become intimate. When a person encounters the essential touch that a sensitive and confident massage practitioner provides, the person's whole system responds, preferably with a parasympathetic nervous response. For many, the closest things to essential touch that they have ever experienced in their life are parenting activities and sexual interaction. Because our bodies react to new situation through comparisons to past experience, a client's response system understandably might interpret these feelings as sexual arousal or as maternal or paternal. Another thing to keep in mind is clients that have had sexual assault or some type of physical trauma in the past may revert to that memory as a response, be startled, have a negative response to touch that you did give that was appropriate, but their body misunderstood it and reacted in a negative way. So please keep that in mind as well. Furthermore, for many adults, the only familiar routine that they have for expressing intimate feelings is as a sexual one. So it's easy to see why the client might misinterpret the sensations and feelings associated with massage, confusing them with sexual response or parenting role. Right, so the massage professional needs to understand the physiological aspects of therapeutic massage and recognize that the same massage techniques that alleviate stress and promote relaxation also stimulate the entire sensory mechanism, all right, which may include a sexual arousal response. The lumbar nerve plexus, which is a plexus is a bundle of nerves, and the sacral nerve plexus. And if you haven't taken the nervous system course yet, this is a bundle of nerves near your lumbar vertebrae region and your sacrum. They conduct sensory information to and from the abdominal area, the lower extremities, the buttocks, and also to and from the genital area. So, stimulation of a nerve plexus area is not confined to that local place that you're touching, but rather is diffused throughout the whole area that those nerves supply. All right, we're going to learn about that in the nervous system when we talk about dermatomes and myotomes. For example, when the lower abdominal area is stroked, say someone has uterine issues, bladder issues, they want the lower portion of the rectus abdominis done. They want the iliopsoas worked on the lower end. Whatever the case may be, the nerve signals of the genital area are also going to be influenced while you're working on the lower abdomen. The entire sexual arousal response is part of the relaxation response through the output from the parasympathetic autonomic nervous system. So every time your client starts getting out of that fight or flight response, they're getting out of that stress response of the sympathetic autonomic nervous system into the more relaxed response. Our physiological factors are present now for sexual arousal in this parasympathetic response. This reaction, which I haven't anecdotally heard of happening to myself or to any of my coworkers, but it has been known to happen to practitioners as well as they begin to relax while performing the massage. So, simply put, on a physiological level, parasympathetic stimulation activates most of the benefits of massage for stress reduction, but this neurological state is also super favorable to sexual arousal. So these physical responses are all connected, but the sexual response is usually short-lived and quickly replaced by feelings of just actual deep relaxation as the massage continues. Responses vary with each client, and the sexual response may be totally bypassed. There are numerous clients, I would say the grand majority, don't even go into the sexual arousal phase at all. However, if physical sexual arousal occurs, and it can both in females and males, you will notice some things changing, like shifts in breathing, tensing up. You'll get engorgement of erectile tissue with the males, and the massage practitioner needs to understand the physiology of this situation and ways to deal with it ethically in the massage room. All of the responsibility is on you as the massage practitioner. You are responsible for putting the whole issue of sexuality into perspective, understanding it clearly, what is happening, and explaining the physical feelings to the client on a physiological level. All right. The practitioner, meaning you, is also responsible for monitoring the client's responses and acting appropriately to adjust the physiology and change the pattern of massage to diffuse the sexual energy. All right, instead of long soothing strokes, maybe we switch to firm, fast percussion for a little while. This is easily accomplished by altering the approach of the session. It's common knowledge that sexual arousal is not purely physical and depends on both psychological and tactile responses. In these ways, the practitioner can modulate the client practitioner responses by changing the topic of conversation, beginning a conversation, stopping what you're doing, changing what you're doing to something firmer. And there's all different kinds of ways that you can alter this. All right, so what is touch intimacy? So the intention of a touch is a determining factor in the interpretation of the touch, all right? The touch of the massage professional is not focused on sexual arousal and release or parenting. So the interpersonal communication skills of the practitioner determine the professional interaction. So how you talk to them matters. Monitor how they respond. Keep the discussions light. Don't let them go into a very personal nature. Change the topic if it goes that direction. Change the environment. The moments of intimacy must be dealt with carefully. Misunderstanding the physiological or psychological responses, the client may interpret them as indications of feelings of romantic love or that the therapist is a new best friend. Okay, clients manifest this in a lot of ways. If your client does not understand subtle interactions or the intimacy of the massage office, the client really isn't the one to be blamed for wanting more attention for the massage practitioner. You get a lot of moments together, a lot of, it's intimate. They're undraped in the areas that you're working. You can laugh, you can talk. Are you supposed to give them advice? Absolutely not. But there is a level of intimacy in the room. All right. You're relieving the day's tension from them. You could be relieving years of pain if they haven't been seeing a massage therapist and they've had chronic pain. Just keep it focused on the client's body and their healing reaction to the massage session. All right. Clients may also look to the massage professional for emotional support beyond the ethical scope of practice for massage. You always need to encourage them to find the support from another source. You are a touch therapist, not a talk therapist. All right. If they need assistance with coping skills, refer them to someone who can help. All right. Guidelines on sexual misconduct. The therapist will respect the integrity of each person and therefore not engage in any sexual conduct or sexual activities involving clients. You will not date a client. You will not commit any form of sexual impropriety or sexual abuse with a client. Whatever the behavior of the client does not matter. It is always the responsibility of the massage therapist not to engage in sexual behavior. All right. You are in the position of power. You are the one that always says no. All right. Sexual impropriety can include any behavior, gestures, expressions that are seductive or sexually demeaning to a client. Inappropriate procedures, included but not limited to disrobing or draping practices that reflect a lack of respect for the client's privacy. Deliberately watching a client dress or undress, inappropriate comments about or to the client, like sexual comments about a client's body or underwear, sexualized comments to the client in any way, shape, or form, criticism of the client's sexual orientation. Like if someone says that they are a lesbian and it's a male therapist and they're like, I bet I could change that. No, that's sexual harassment immediately. Discussion of potential sexual performance, conversations about the sexual preferences or fantasies of the client or the massage therapist, any request to date. Sexual abuse is quite a bit stronger. This is therapist-client sex, whether it is initiated by the client or not. You are in a situation of a therapeutic relationship. There is a power differential. You are breaking the law. You are not to initiate any sexual contact with them, but you are not to engage in it if they are the ones that initiate it. Engaging in any contact with a client that is sexual or reasonably may be interpreted as sexual could be genital to genital contact, oral to anything contact, except for they put in here cardiopulmonary resuscitation, CPR, although that has phased out. They don't even suggest doing any breath work in CPR anymore and just maintaining pumping for the heart rate to keep oxygen going up to the brain. All right. Touching or undraping the genitals, anything in these regions, undraping or touching the breasts. The exclusion in this, of course, is if you were doing medical work post-op or for a pregnant or lactating client, but that's a separate topic. If it's not that special circumstance, it is absolutely considered sexual abuse. Any masturbation by the massage therapist while the client is present, or masturbation of the client by the massage therapist. All right. There will be no legal happy endings in your massage because they are not legal in the United States. All right. So Gary has included some awesome practice questions for the MBLEx here regarding sexual harassment, sexual innuendo, and sexual abuse. So we're going to go over a couple of those. If a practitioner allows a client to make sexual jokes in the treatment room, this is considered A, inappropriate tolerance of sexual innuendo, B, sexual abuse of the practitioner, C, fine so long as the client makes the jokes and not the practitioner, or D, fine so long as the practitioner is not offended by the joke. If the practitioner allows a client to make sexual jokes in the treatment room, this is considered inappropriate tolerance of sexual innuendo. Regardless of the behavior of the client, it is always the practitioner's responsibility to A, refrain from sexual behavior, B, prevent the client's sexual arousal, C, give the client a second chance, or D, accommodate the client. Regardless of the behavior of the client, it is always the practitioner's responsibility to refrain from sexual behavior. Sexual arousal can occur without the client's active intention as part of which type of response? A. Circulatory. B. Sympathetic nervous system. C. Parasympathetic nervous system. Or D. Entrainment. Sexual arousal can occur without the client's active intention as part of the parasympathetic nervous system response. If a practitioner has strong sexual or romantic feelings for a client, the best course of action is to A. To attempt to hide these feelings from the client, B. To release the feelings by discussing them with a friend, C. To refer the client to another therapist, or D. To explain the feelings to the client and ask for a response. If the practitioner has strong sexual or romantic feelings for the client, the best course of action is to refer the client to another therapist. If you use a nickname for a client, such as Honey, and the client asks you to refrain from using the nickname and you use it again, it is considered A. Sexual impropriety, but it will not result in legal actions. B. Sexual harassment and may result in sexual abuse charges. C. A breach of client confidentiality that may result in jail time. D. A breach of client confidentiality, but it will not result in legal charges. If you use a nickname for a client, such as Honey, and the client asks you to refrain from using the nickname and you use it again, it is considered sexual harassment and may result in sexual abuse charges. If a practitioner compliments a client on how good she looks in her jeans, this is considered A. Use of good rapport building skills to put the client at ease. B. Lack of attention to client confidentiality. C. Use of sexual innuendo, whether intentional or not. D. Use of warmth and proper intimacy to build client communication. If a practitioner compliments a client on how good she looks in her jeans, this is considered use of sexual innuendo, whether intentional or not. In which circumstance is it permissible to form a romantic relationship with a client? A. Both parties consent to the romantic relationship. B. 6 months has elapsed since termination of the professional relationship. C. The client receives only one session per month. Or D. The client receives only reflexology and not full body massage. In which circumstance is it permissible to form a romantic relationship with a client? It is when 6 months has elapsed since termination of the professional relationship. Showing artistic pictures of nude bodies in a massage business environment is considered A. Appropriate so long as both male and female bodies are shown in equal measure. B. Sexual innuendo that is not associated with sexual harassment. C. Appropriate so long as no genitals are displayed in the images. Or D. Sexual innuendo and can lead to sexual harassment charges. Showing artistic pictures of nude bodies in a massage business environment is considered sexual innuendo and can lead to sexual harassment charges. Clients may experience unwanted sexual arousal responses because A. The head, neck, genitals, and trunk region share the same nerve plexus. B. The abdominal area, gluteal region, lower extremities, and genitals share the same nerve plexus. C. The upper extremities, trapezius, genitals, and sternocleidomastoid share the same nerve plexus. Or D. The hands, wrist, ankles, feet, and genitals share the same nerve plexus. Clients may experience unwanted sexual arousal responses because the abdominal area, gluteal region, lower extremities, and genitals share the same nerve plexus. Which of the following is not inappropriate sexual behavior on the part of the practitioner? A. Telling sexual jokes. B. Entering the room before the client is completely dressed. C. Conversing about personal sexual issues. Or D. Undraping a client's lateral gluteal muscles. Which of the following is not inappropriate sexual behavior on the part of the practitioner? That would be undraping a client's lateral gluteal muscles. In the case of client misconduct, such as making a sexual advance, the practitioner should document this on A. Confidentiality agreement, B. Release of information, C. Police report, or D. Incidents report. In case of client misconduct, such as making a sexual advance, the practitioner should document this on an incident report. Because of the power differential between practitioner and client, any sexual misconduct, even if the client consents or initiates, is legally considered A, mutual, B, abuse, C, disrespect, or D, neglect. Because of the power differential between practitioner and client, any sexual misconduct, even if the client consents or initiates, is legally considered abuse.